the patient doesn't do the most important thing, which is to change the process that caused the disease. Because a lot of people also think that diabetes is just high blood sugar, high blood glucose, right? Yes. Oh, diabetes is high blood glucose. That's not true. High blood glucose is a consequence. When your blood glucose gets high, it's because you're already starting to have pancreatic failure. What makes you diabetic is the excess insulin. It's insulin resistance, which we call metabolic syndrome. That's what makes the patient diabetic. Insulin resistance, the body asks for more and more insulin, the receptor becomes resistant, and then it gets to a point where the pancreas fails, and then insulin stops working. Then you have the main symptom, which is excess glucose in the blood. I see. So this isn't explained clearly to the diabetic patient. What happens? They just do it, they take the medication. You know how patients are, right? He asks the doctor, but can I drink beer? Then the doctor says, have 2 cans on the weekend. Then the guy drinks 12. Right? It's true, he drinks 12. If you tell the patient he can drink 2, he'll drink 12. And then, oh, can I eat sweets? Oh, once in a while. The guy's once in a while is twice a day. And then he ends up destabilizing the disease. And look, I'm not saying here that it's forbidden to eat sweets or to drink beer. It's just that people do it the wrong way. That's why I'm going to do this big class on Tuesday, to explain exactly the step-by-step everything you can do, but there is a right sequence. There is a right time. There is a right methodology. So, this problem of getting the diagnosis and the disease continuing to progress is because the medication is just one part of the treatment. It's not the most important, it's one part. The most important thing is making lifestyle changes in the right sequence, which unfortunately people don't do.
And what is the biggest myth about diabetes that you still see spreading and that in the end ends up making people worse without them realizing it?
Look, diabetes is a disease, actually. It doesn't have just one myth. It has many, many myths. Maybe the biggest one, we just talked about it here, right? That diabetes is a life sentence, right? The guy who is diabetic, he's going to be diabetic for the rest of his life. He's going to take medication for the rest of his life. Unfortunately, I still see a lot of doctors talking like this, saying you'll have it for the rest of your life. You'll have to take it for the rest of your life. For me, this is the biggest myth. But there are others. For example, my blood sugar is normal. I'm great. Many times the person is already diabetic. She is already diabetic with normal blood sugar. Because this person's blood sugar is normal, remember I mentioned insulin? Yes, at the cost of high insulin. In other words, she already has high insulin, she's already insulin resistant, but this large amount of insulin is pushing the excess glucose into the cells, so her blood sugar is still normal. When blood sugar changes, that's already the beginning of the failure process of the islets of Langerhans in the pancreas, which will then start having trouble producing insulin. That's when blood sugar starts to change. In other words, blood sugar changes because you have insulin resistance and the beginning of pancreatic failure. So that's another problem, thinking that your insulin is fine and that you're doing great. I'm tired of seeing patients with high HbA1c, high insulin, and normal blood sugar. If the person doesn't change their lifestyle, their blood sugar will start to change in about a year. Because blood sugar, as I said, is a symptom, it's a sign, it's not the cause, it's the consequence.
And is this something that's not mentioned during the appointment that the patient needs to know, needs to hear?
No. Look, sometimes I even think it's mentioned during the appointment, but it's kind of said in passing. And I even understand some doctors because it really is. I heard from a doctor this week who said, try telling the patient they can't do this or that. Right? I understand. But it's very important to make it clear. That's why it's not that I'm against medication, you know, Vanessa. Diabetes medication is important. If you take it, please don't stop, don't discontinue it. They have an important role in the treatment plan, but I don't think it should be the first step